Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I am here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. Welcome, so glad to have you.
The early weeks of dental hygiene school can feel a little overwhelming, to say the very least. But think about all the knowledge that is needed in order for you to see your very first patient. So some of that overwhelming feeling is certainly justified. There's a lot that you need to know. So my advice to you, it's important for you to practice the basics and spend time every single day working on your muscle development. Shortly after you're introduced to that modified pen grasp, you'll begin to learn about each of the instruments that are in your kit. This episode is going to review the design characteristics of the standard universal ultrasonic tip and compare those characteristics to the design of the periodontal probe, which is one of the first instruments that you learned how to use in the preclinical setting. Students should be able to discuss the functions and characteristics of both the periodontal probe and the standard ultrasonic tip and be able to identify the similarities between them. So there's lots that you can apply from one instrument when you're learning the other. So that's what this episode is going to cover.
Hey, if you're in hygiene school or just got your acceptance letter to hygiene school, I've got a new course to help set you straight right out of the gate when you first start your program to help ensure a successful transition from the first semester to the second semester and to the finish line. I will help you strategize all the key strategies that you need, understand what the challenges are, and overcome all the obstacles. Learning in dental hygiene school is different than any other program. You've got a lot of assessments that are evaluation style. You need to be able to plan and prepare for that and be successful so that you can become an RDH. And I'm here to do that for you. I have a new course, How to Be a Successful Dental Hygiene Student. You can click the link right in the show notes and I'll show you how to get it done. Congratulations on entering this profession.
First, let's take a look at the design characteristics of the UNC 15 periodontal probe. And this is a very standard, widely used probe and may or may not be what's in your kit. It has a tapered end with a very straight shank. The measurements on the UNC 15 probe are in millimeter increments. The UNC probe is adapted around the neck of the tooth and it's aligned with the long axis of the tooth when you're using it. We're discussing the UNC 15 probe, but please know that there are many probes. But when I'm talking about the specific features, like the straight shank and the tapered end, most probes have this style and design. The design of the probe is long and thin, and the working end of the probe is straight and tapered with a really blunt end to it. The markings on the probe are noted based on the type of probe that you are using. Most importantly, the probe is used with a very light grasp. Now, probing is the act of walking the tip along the junctional epithelium within the sulcus or the pocket with the purpose of assessing the health status of the tissue. The probe is gently inserted into the pocket with a very light amount of pressure and accessed to the base of the sulcus. It is then walked along the junctional epithelium. The probe should be adapted around the neck of the tooth, following that vertical long axis of the tooth using a walking stroke and maintaining parallelism. The walking stroke is the proper stroke to use with the periodontal probe. When you're performing the walking stroke, the probe is walked along the base of the sulcus right at that junctional epithelium, approximately 1 millimeter apart, while maintaining that parallelism and adapting to the tooth as you walk along. The standard universal straight ultrasonic tip has a very straight design, similar to that periodontal probe, with a concave face and a very convex, rounded back. Like the periodontal probe, the straight ultrasonic tip is thin, straight, and tapered with a blunt end. Both of these instruments have a straight working end and a blunt tip. Both are used with a very light grasp. Both instruments share similar design features with similar adaptation techniques that follow the vertical axis of the tooth. The standard ultrasonic tip has a probe-like design. The tip is slim and straight, and it gently slides into the gingival sulcus to gain access to the root areas. The long axis of the tooth is followed to maintain correct adaptation. The tip is walked along the root surface to disrupt biofilm and remove stain. The straight ultrasonic tip is straight with an internal flow of water. It has water delivery that comes right from that concave area. The standard ultrasonic tip can be positioned in a very similar way as the periodontal probe on the lateral surfaces. The straight ultrasonic tip can be used in a vertical technique that follows the long axis of the tooth. You want to use a light grasp and follow the contour of the root surfaces. The point of the tip on that standard ultrasonic tip should never be held perpendicular to the surface of the tooth. That's a big caution when you're learning to use the ultrasonic tip. The standard ultrasonic tip should be kept moving at all times, using a combination of strokes that are overlapping and meant to cover the entire surface area of the root. Picture that you're coloring the root surface with the side of that standard ultrasonic tip. The design shape is similar to the periodontal probe design, with that long, straight working end that tapers with the blunt end. The standard straight ultrasonic tip has that curved shank and a tapered tip. The active tip area is the first 2 to 4 millimeters of the instrument tip on that ultrasonic tip. It's important to note that the middle finger does not rest on the upper shank of the ultrasonic tip because it would reduce the vibration and the effectiveness of the working end. The insertion angle is as close to 0 degrees as possible, and once the tip is inserted, it's opened between 0 and 15 degrees and then activated. You need to pivot on your fulcrum in order to maintain correct adaptation around the tooth, and this applies to both the standard tip and the periodontal probe. Pivoting on your fulcrum is an essential skill that you will learn in your preclinical setting. As you pivot on your fulcrum to maintain proper adaptation, you want to have the tip always following the long axis of the tooth. The standard ultrasonic tip is directed towards the junctional epithelium, but used on the root surface areas. The tip is in a vertical orientation to the long axis of the tooth. If your vertical angle is greater than 15 degrees, you are using the instrument at an incorrect angle. Both the standard universal straight ultrasonic tip and the periodontal probe are positioned as parallel as possible to the tooth surface in alignment with the root axis. Although the probe and the straight ultrasonic tip have completely different functions, strokes, and job descriptions, there are many similar features that can be correlated to help you, the dental hygiene student, apply these similar features to reduce the learning curve as well as the hesitation to use the standard ultrasonic tip when it is introduced. It is best to build on what you already know, especially when we're learning something new that may seem very unique. It may be less unique than you think when you can relate it to something that you are already familiar with. I would say for most students, when they first are introduced to the ultrasonic, it seems a bit scary because it's the first time you're using your feet and your hands together. And there's water going everywhere that you have to manage. So if you can take some components of the learning curve of using that ultrasonic tip and apply it to what you're already developing as skills when you are learning the periodontal probe, it will go a long way at reducing your hesitation and putting you at ease as you're developing your skills.
Thanks for joining me today. In the next episode, we're going to be taking a look at the tooth morphology of the maxillary and mandibular canines. This will build upon what you've already learned about the tooth morphology of the incisors. I hope you join me. I would invite you to ask any questions at all that you need answered. Sometimes questions come up when you're listening to this podcast. If you have a question, most likely someone else has the very same question. I'd be happy to answer it and would probably share it in a future podcast.